So a lot of people know that there are wait times when you come to the emergency department. The most important reason for this is that the emergency department functions differently than other offices. We see the patients on the basis of how sick they are, so we see the worst first. So if somebody comes in with a heart attack or a stroke or a serious infection, they get seen before people with more minor complaints like ankle sprains or sore throats. We know that when you're in the emergency department, sometimes it takes a long time to get through the process of the visit. That's because a lot of the times tests are ordered, things like ECGs, lab tests, diagnostic imaging like x-rays, CT scans, and ultrasounds. All of these things can take time. Oftentimes, consultants or specialists are required to see the patients, and this can also add to the time spent in the emergency department. The other issue is that certain times are very busy for the emergency department. Oftentimes later in the morning, and then towards the evening, it's very busy in the emergency department as people become sick during the day or realize they're sick after work or school. Over the holidays, during times when walk-in clinics are closed or family doctors are unavailable, the wait times do go up as well because patients have very little in the way of other places to turn. But keep in mind, for those patients that are seriously ill, the wait time is always the same, 0 minutes. If you really need the care, very quickly we're there to provide it for you. Some of the things you can do to avoid an emergency department visit is to plan in advance. If you know your prescriptions are going to need to be refilled over the holidays, consider calling your family doctor early for an appointment. If you have an urgent concern, which could be dealt with at a walk-in clinic, consider checking medimap.ca. This will tell you wait times and availability of walk-in clinics in your area. The nurse line, 811, is available 24 hours a day, 7 days a week, to provide you with health advice that might prevent your emergency department visit. If you have a mental health concern, you can call the Fraser Health crisis line 24 hours a day for advice regarding your mental health issues. Another option is to consider talking to a pharmacist. They can provide you with great information regarding your medications as well as over-the-counter remedies.